Hi, my name is Lauren Walters, and I have chosen the rubella virus to share with you all today. It is also known as the German measles. Rubella is a contagious disease that is caused by a virus. It's also called the German measles or the three-day measles, but don't confuse rubella with the measles. The measles are sometimes called rubiola, which is different than rubella. The two diseases have similar features, including a red rash, but they're caused by different viruses. According to the CDC, before the rubella vaccination program started in 1969, rubella was common and widespread infection in the United States. During the last major rubella epidemic in the United States from 1964 to 1965, an estimated 12.5 people got rubella. 11,000 pregnant women lost their babies, and 2,100 newborns died. 20,000 babies were born with congenital rubella syndrome, but once the vaccine became widespread, the number of people infected with rubella in the United States dropped dramatically. The pathophysiology of rubella. Rubella is a complex virus with an enveloped positive single-stranded RNA and is a member of the Togaviridae family. The virus varies in spherical shapes and is between 40 and 80 nanometers in diameter. The core of the virus is an electron-dense and approximately 30 nanometers in size, and is comprised mostly of the polypeptide C. The exterior of the virus is made up of hemagglutinin, and this picture right here shows what it would look like, the virus itself. There are two types of rubella. Congenital rubella is the first one we will talk about. It's the most serious form. It's seen in pregnant women and their fetus. So the pregnant woman would get the virus and pass it along through the placenta, and that would affect the fetus. The pregnant woman could be asymptomatic, which would mean she might not have any symptoms, but the symptoms to the fetus could be serious or life-threatening. It can cause deafness, heart defects, cataracts, birth anomalies, or stillbirth, and these can be temporary or permanent. It's most susceptible in the first trimester of pregnancy because this is when the baby is developing all of its major organs, and that's when it can really be the most detrimental. Okay. The second form of rubella is postnatal. This is the most common form. It can also be asymptomatic, or it can be mild in children. Adults can get it. Most of the time children get it, but adults can get it, and they just get it a little bit more severely than children. Their symptoms are just a little bit more severe. It can cause fever, joint pain, and flu-like symptoms, but the most noticeable sign is a rash that starts on the face, and it moves through the whole body. Like this picture here you see in the baby, it's just everywhere. And it can last up to 3 days. Some other symptoms might be swollen lymph nodes, cough, just anything that may be like a flu-like symptom. The rash is characterized as a flattened red spots called macules. Virulence. The most common portal of entry through the mucous membrane via aerosolized mucus or physical contact. It's often seen through coughing or sneezing, with those germs just coming right out. Often seen in schools or daycares where children are, they're real close together, they're coughing on each other, they're sneezing, their hygiene is not the greatest. For congenital rubella, the virus would cross the placenta to the fetus. Unvaccinated children, because obviously they've not had the vaccine and they are just more susceptible to getting it. And somebody that's never contracted the virus before. Once you've had rubella, you're likely not to get it again because you've built up antibodies that would fight that. In rare cases, people have gotten it a second time, but for the most part, once you've contracted it, your body will fight it off and you won't get it again. Populations affected. Rubella has been eradicated in the United States, but still remains a problem in other parts of the world. So, if somebody has contracted this somewhere else and has come over to the United States and infected some kids that have not been vaccinated yet, that could start a small outbreak again. But right now, the United States is eradicated of it. Pregnant women are still at highest risk because of the severe effects of the fetus and unvaccinated children. Treatment. There's currently no treatment for rubella. I am sorry. There's no treatment for rubella. In children and adults, it for the most part is it just kind of runs its course. You can use Tylenol to help manage the flu-like symptoms, but there's no treatment or cure. It will run its course. And prevention is very big, however. The MMR vaccine is to prevent the measles, mumps, and rubella. This has eradicated rubella from the USA since 2004 and is no longer considered an endemic here. Doctors recommend 2 rounds of vaccinations at 12 to 15 months of age and again at 4 to 6 years of age. It can be administered as early as 6 months of age. Isolation is important because it's an airborne virus and can spread very easily. Personal protective equipment should include gloves, a face mask, and maybe even a gown in a situation where bodily fluids are likely to be present. And hand hygiene, whether you're in a hospital or at home, hand hygiene is the best way to prevent any kind of virus spreading. So that is all about rubella, and thank you very much.